Joining us live is Ballard Health Chief Infection Prevention Officer Jamie Swift. Ballard's hospitalization numbers, Jamie, have remained pretty steady over the past few days, around that sort of 70 to 80 range. What's your read on this, and is this encouraging to you?
Encouraged by the numbers. We certainly see those coming down. We're pleased with that. We don't want to plateau here. We certainly want to get those numbers a little bit lower. So, that's why we don't get too crazy. We like to say we're cautiously optimistic. Things are going good, but not good enough to let up on any of our interventions.
Some big news in the vaccine world with the FDA's emergency approval of the Johnson & Johnson 1 dose. How quickly do you think this could make an impact in the local vaccination push?
There's not a huge supply of J&J coming out immediately, but I think within the next couple of months, you're going to see that really available across the state and across the nation. They'll start to see more and more availability with the other vaccine schedules as those open up and doses. I really feel like we're on a good track with vaccine, and the more vaccine we can move into arms, the better we're going to be.
So it's going to be a while before we see it here in large amounts based on what you're hearing?
In large amounts, yes. I think you may start to see some show up. We're not sure yet. We've just not heard who's going to get what going forward and where that J&J is going to live. We fully expect that to live in doctors' offices and places like that that don't have the ultra cold storage that we do. So we expect to keep getting Pfizer. I think this will move into some of those physicians' offices where people can have more access directly with their physician.
And it's so much easier to store. I know that'll make a big difference as well. I know you and your colleagues are closely watching the variants. So I'd like to ask you about the Virginia Department of Health report that they had a B117 variant actually identified in 3 adults in Southwest Virginia this weekend. And you've said in the past these are kind of random samples that are being pulled out and they're testing it, and they've now found the variant. How concerned are you about the prevalence of the variant strain of COVID-19 in our area?
I think it kind of confirms what we've suspected for several weeks. It confirms the variants here. So none of those 3, I believe, had any sort of travel. And so that tells us they got that by community spread, which means the variant is now spreading. And that's exactly why, even though we have vaccine rolling out and our numbers are coming down, with that variant in the region, that's why we have to continue social distancing, wearing that mask, washing our hands, doing all of those things. So hopefully we can keep the variant spread very minimal and not see a rebound effect that none of us want to go back to.
Is it still the thought that the variant is like the COVID-19 in that it's more easily, spread, more contagious? Is that still the thought?
Yeah, it does appear to be more contagious. And so, wearing those masks certainly are going to help. Getting the vaccine, even if it doesn't provide the full effectiveness up to that 95%, we do think it provides some protection. And so getting that vaccine is still going to be important to help us to control the spread of the variant in this region.
We also heard from Virginia's health department 31 cases of this multisystem inflammatory syndrome, or is it MIS-C in children? Is that the way you're pronouncing it? And
Yes.
Have we seen any of that here? What is that?
So that's that inflammatory response that has been seen in children. They have started to see it in adults occasionally too, but it really can be about 4 to 6 weeks after that COVID diagnosis. They'll start to have just some inflammatory symptoms, not feeling well, really go downhill again. We do continue to see that in our region. We have had hospitalizations continue at Niswonger Children's Hospital with that condition. So, it's an important message for parents to know. If your child has COVID, even a very mild illness, that 4 to 6 week mark, if they start having new symptoms, headaches, stomach aches, muscle aches, anything going on, high fever, sometimes a rash, anything that they're concerned about, they certainly need to seek medical care.
And that would come not right after they're better from getting it, but a few weeks later. Is that right? So I would think that's difficult for moms and dads. So what's going on here, right? It can be strange.
It is. It's really that 4 to 6 week mark. So, you just kind of need to maybe mark it on your calendar. So if you've got a child that has COVID, just make yourself a reminder in that 4 to 6 weeks, if your child seems to be having a setback, just call your medical provider. It may be something else. It may be a routine viral illness going around. It may be strep throat, any of those things that we see this time of year, but it needs to be on their radar to watch for.
We very much appreciate your time, Jamie Swith with Ballad Health. Thanks so much, and our best to you and all the folks on the front line helping take care of people tonight. We appreciate it.
Thank you.
Sarah?